Hello, thank you for joining us for the Assessing Functional Domains webinar. I am April Black and I am an Adult Programs Representative with the North Carolina Division of Aging and Adult Services. This is a general educational experience and is not intended as legal advice or case-specific guidance, but rather is a basic skills overview. Specific cases can be discussed with the Division of Aging and Adult Services representative upon request through the listserv. To my knowledge, all the information is accurate at the time of this recording. However, laws and policies are subject to change. This webinar is not a substitute for face-to-face training, but rather is a helpful addition to face-to-face learning experiences. An attachment entitled CMAP Functional Domain Assessment Guide has been included to accompany this training. Please ensure you have this attachment handy to reference during this training. If you do not have this attachment available at this time, you may pause this webinar to obtain it. In this webinar, you will gain an understanding of the following. How does the assessment of the functional domains intersect with the requirements of law and policy? How does the assessment of the functional domains build rapport with clients served by adult services? How can each of the domain areas be thoroughly explored using innovative and thorough practical applications? Multiple programs in the adult services scope of service provision have requirements for thoroughness. Let us contemplate Adult Protective Services Statute and Administrative Code. Focus your attention on the displayed general statute and note the significance of the word thorough. Webster's Dictionary defines thorough as carried through to completion, marked by full detail, complete in all respects, and having full mastery. North Carolina Administrative Code further defines a thorough evaluation and gives us our first glimpse of the domain areas we will analyze today. As we navigate through this webinar, I will refer to the domain areas identified in the previously referenced North Carolina Administrative Code by the easy-to-remember acronym of CMAP. This acronym is a helpful tool for you to remember these areas as you are navigating your casework. To help ingrain this in your memory, let us say the words aloud together now. Social, environmental, economic, mental health, activities of daily living, and physical health. As mentioned, there are multiple programs under the oversight of adult services that have requirements for assessing these domain areas. In other words, this is not limited to just the Adult Protective Services evaluation. Assessing functional domain areas is an ongoing and constant task for all adult services cases from beginning to end. As evidence to the vast scope of programs charged with assessing domain areas, displayed you see excerpts from the guardianship and SA and home manuals that reference back to the domain areas. Multiple tools created by the Division of Aging and Adult Services assist with guiding the assessment of the functional domains by providing a framework for the gathering of this information. Pause this webinar now and see if you can guess which forms the excerpts originated from. Form example 1 comes from the community and the facility evaluation forms. Form example 2 originated from the functional assessment, which is used in an array of programs, including but not limited to guardianship and SA and home. Form example 3 derived from the status report completed on behalf of wards. Form example 4 is from the facility evaluation. As you can see, there are many forms in the Adult Services Social Workers Toolbox that encompass the need for assessing the 6 domains so that the social worker can gain an understanding of the adult's functioning as it relates to strengths and areas of need. While there are several forms to assist in the gathering of this information, assessing domains requires asking exploratory questions. The social worker should never use the forms or the CMAP Functional Domain Assessment Guide as a script, but rather as prompts to better understand the adult and their strengths and needs. The more familiar a social worker becomes with these questions, the better equipped the social worker will be to thoroughly assess the adult's strengths and needs and to match the adult with any needed services. There are multiple research studies that focus on loneliness in older adults. In the 298-page publication titled Social Isolation and Loneliness in Older Adults, statistics are cited which show that loneliness is not only a huge concern for the population served by adult services, but also of the disparaging impacts on health and welfare that come from loneliness. Famed psychologist Abraham Maslow even placed the need for connection right in the middle of his hierarchy of needs. And understanding that those we serve have a need for connection, we may proceed to our first contacts with the adults we serve on autopilot, under the assumption that the adult will readily discuss their strengths and needs or that they will want us there. This would be an inaccurate assumption. While all human beings have a need for social connectedness, this connection cannot be forced or rushed. Rapport building is essential. Imagine if a stranger appeared on your doorstep and began to inquire about the most sensitive areas of your life. If you have not built a foundation of trust with this person, or if you question their motives, it is unlikely you will share. Assessing CMAP can be a great way to build rapport, specifically when it comes to the social domain. One example of a way to build rapport when first meeting a client is to observe the environment for the 3 P's: pictures, plants, or pets. Many people have fond relationships with one of the 3, and this can often be seen in the home. You may observe pictures of family members, plants, or evidence of an animal living in the home. Starting a general conversation that brings positive feelings to the adult will begin to build rapport with the adult and is also beneficial in starting to explore CMAP. Before we move towards learning innovative and practical applications for assessing domains, consider this teaching analogy that will help you remember the domains when you are navigating through your social work practice. Imagine a boat drifting towards an ultimate destination. What sort of tools would help guide and direct that boat? First, it might be helpful if you could see a map. Second, it is unlikely you will make any good progress without a set of oars. In this analogy, the boat represents your overall assessment that is getting you to your conclusions regarding a client's strengths and needs. CMAP represents our functional domain areas. The oars represent a global approach to securing information relative to the functional domains via the method of observe, ask, research. As we discuss practical applications, it is imperative to remember 3 things. First, assessing domains is not merely asking the adult. It is a total assessment using social work skill set that involves observing, asking, and researching. Secondly, remember the CMAP Functional Domain Assessment Guide is not a script. It is not intended to be all-inclusive, but rather is a tool that you could use. Every client served has individual needs, and therefore should never receive cookie-cutter casework, but rather should receive assessments based on their needs. It will be up to the social worker to determine which questions need more exploration. Finally, remember the guide is by no means all-inclusive. We will now discuss innovative and thorough practical applications. You may find it helpful to reference your CMAP Functional Assessment Guide during this section. I will not read through each set of questions, but rather will allow you to do that at your leisure. However, I will highlight areas of consideration. You will note that your CMAP Functional Assessment Domain Guide displays practical application by giving tangible questions and tasks. When assessing the social domain, it is imperative to know the demographics of all household members. However, you do not stop there. It is important to gather information to analyze the relationships. Are these relationships supportive, or are they contrary to the health, welfare, and safety of the adult? The social domain area does not stop within the household, however, as social connections span from household members to family and friends outside the home to community supports connected to the adult. It is important not to assume relationship value for the adults you serve. Just because someone has others in the home with them does not mean these relationships are healthy. In the same regard, family is not always connected by blood or legal ties, and it is important to explore and value those who the adult labels as family. Displayed is a sampling of how the observe, ask, research model could be utilized in practice to assess the social domain. When assessing the environmental domain, observation will be of the utmost importance. The social worker should survey the environment outside and inside the home like a video camera, documenting clearly what exactly is seen without bias. Look at the photo on this slide. What would you think if the social worker documented the observations of this picture by stating, quote, "the home was dirty," unquote? The statement is not particularly helpful in that it does not communicate what is actually observed. In fact, this photo conveys a strength and that there are dirty dishes indicative of recent meals having been consumed. A better way of documenting would be to be clear about what is seen, such as stating, quote, "the sink had dirty dishes in it," unquote. Would the concern be increased if the dishes had rotted food and pests surrounding them? Absolutely. This is why you want to be clear to document what you are seeing. The goal of the environmental assessment documentation is to paint a picture such that the reader can draw the conclusions based on the facts given. Another example would be that observing that the temperature in the home is, quote, "comfortable" or "appropriate," unquote, does not confirm that the heating and air system is working properly. Additional activities would be necessary to validate that the heating and cooling systems are in working order. In thinking about temperature issues, remember that various disabilities and aging in general can impact the circulatory system and therefore the way that temperature is felt. This is where the component of ask comes into play. It is important to ask the adult how they feel about the environment. The home could be 90 degrees and unbearable to the social worker, but the temperature could have been set by the adult out of their preference and not because of a need. Do not make assumptions, but rather observe, ask, and research. The social worker should be able to determine how the environment affects the adult's functioning and if there are any factors in the environment that are detracting from the adult's ability to function safely. This will be helpful in determining if the current environment is appropriate for the adult to continue to reside or if there are things that need to be addressed to ensure the individual is able to remain safely in their current location. Displayed is a sampling of how observe, ask, research could be utilized in practice to assess the environmental domain. When assessing the economic domain, the social worker should perform a comprehensive assessment of the adult's economic functioning. While observations such as are utilities connected and verbal information such as the adult reports information about income and expenses are important sources of information, the social worker should work diligently to gather written financial data such as bank statements and invoices when needed. Adults are often resistant to share information regarding their budget or financial resources. There may be a variety of obstacles in obtaining financial information, but this should not prevent the social worker from gathering sufficient information about the adult's economic functioning. The social worker should clearly document all efforts taken to secure financial information from the individual, collaterals, and caregivers. In adult protective services situations where written documentation is needed but not willingly provided, it may be necessary for the social worker to utilize tools such as the freeze and inspect order or the subpoena directing the release of financial records to acquire this information. Remember that the purpose of gathering this information is to determine the adequacy of resources and meeting the adult's basic needs. Displayed is a sampling of how the observe, ask, research model could be utilized in practice to assess the economic domain. When assessing the mental health domain, observation and research take the stage for pressing importance. While asking is important, remember that mental health is a sensitive subject with a lot of social stigma attached to it. While some adults will readily disclose their feelings, others are not so inclined. It is important to notate what you see as it is. The impact of problems related to the adult's mental health can be significant regarding their functionality and their capacity for informed consent. A key factor in assessing an adult's mental health status is to consider the impact of mental health issues upon the individual's functioning. For example, while it is important to note that the adult experiences memory loss, the impact of this diagnosis on the adult's well-being is crucial in drawing a conclusion as to the adult's needs. Documentation of mental health observations must be clear and concise. Remember that as service professionals, we are leaders in breaking the stigma associated with mental health, and therefore we must avoid at all costs jargon or derogatory descriptions, such as, quote, the adult was acting crazy, unquote. Instead, the social worker should describe what is seen, such as that the adult, quote, smelled of alcohol and was slurring and speaking at a rapid pace about the upcoming alien invasion, unquote. While it is important to ask the adult about their perception of their mental health, as is the case with all of the domain areas, it is equally important not to rely on the adult to be the sole historian for your case. Consider framing and reframing questions. For example, you might say, do you have any feelings of sadness or worry today? As a means of starting and normalizing the mental health conversation, as opposed to, do you have any mental health problems? Suicidal or homicidal ideation should be taken seriously and evaluated by qualified mental health professionals. It is important to understand your agency's plan for response in these situations. Displayed is a sampling of how the Observe, Ask research model could be utilized in practice to assess the mental health domain. When assessing the activities of daily living domain, you will notice that other domain areas intersect. For example, the support of friends and family can assist with the activity of daily living, which is housekeeping, and ensure a safe home environment. In addition to the broader subject of activities of daily living known as ADLs, assessing activities of daily living also includes looking at more complex abilities known as instrumental activities of daily living, or IADLs for short. IADLs can include managing your budget, remembering to go to doctor's appointments, or taking medications as prescribed, being able to do housework and prepare meals, or managing transportation, among other activities. The social worker should focus on the adult's functioning to include the adult's level of independence or dependence on others to assist with needs. The social worker should explore the adult's understanding of their functional limitations, if any, and the adult's strategies to meet their essential needs. In addition to discussion with the adult and his or her support network, the social worker should observe the adult's functional ability. Consequently, it may be appropriate to ask the adult to demonstrate their ability to perform certain tasks. The questions or observations should determine if the adult is physically and/or mentally incapacitated, and how it affects the adult's ability to perform or secure basic tasks of self-care. Displayed is a sampling of how the Observe, Ask research model could be utilized in practice to assess the activities of daily living domain. When assessing the physical health domain, you will want to remember to not draw assumptions. Remember that physical limitations are not always visible to the eye. In addition, what is visible to the eye may not be a true concern at all when appropriately explored. For example, an adult may appear underweight, but have ample access to food and nutrition and have had a lifelong diagnosis of being underweight. Information regarding physical health may be obtained from various sources, including, but not limited to, the adult's input, medical professionals and service providers' assessments and input, medical records, social worker observations, caretaker information, family, friends, and support network input. It is important that the social worker gather information from a variety of sources to complete a comprehensive assessment of the adult's physical health. For example, the adult's physician may have limited knowledge of the disabled adult's health regimen in their home, but may be a good source of information from physical assessments and medical tests. Conversely, friends and family may provide insight for the social worker into the daily health-related activities of the adult, but may be unaware of the adult's diagnoses and physician's recommendations. A physical condition, disease, or diagnosis that limits one person may not limit another. For example, arthritis and heart disease in one person may not impair that individual's functioning, while in another, it keeps them confined to bed. Each person and situation is unique. Displayed is a sampling of how the Observe, Ask research model could be utilized in practice to assess the physical health domain.
We will now discuss special circumstances that may present for a social worker assessing CMAP that could create additional challenges. The first scenario that would require a sharper skill set to assessing CMAP is assessing CMAP in non-residential settings. These settings could include hospitals, detention centers, nursing homes, adult care homes, or a vast array of any setting other than private residences. The requirement to assess CMAP does not change if the client is not residing in a private residence. There is also never an assumption that because the client is not in a private residence, that their needs are met more or less than they would be in a private residence. Rather than make assumptions of safety, or lack thereof, the social worker must use the method of observe, ask, research to assess CMAP. While much of the assessment involves the same thought processes as described previously, specific examples of differences are notated on this slide. Non-residential settings often have more readily available records and collateral contacts. It is important to utilize these additional resources to assess CMAP. In addition, a client placed in a non-residential setting may have more barriers to verbal communication. As a result, enhanced observations and research may be required. An adult services social worker may find their client in an emergency at any time. An emergency may warrant the need to call 911 immediately, or it may require more questions to assess the emergency need. During an emergency, the social worker can still gather information and assess CMAP, but focus may change to those areas of the highest priority of need. For example, if a client had the appearance of gangrene in their leg, characterized by extreme swelling, numbness, pain, skin breakdown, and discoloration, it may be necessary to ask questions with a focus on physical health needs. The social worker can also include in their documentation the immediately and readily available context clues for other areas such as social support, environmental, and mental health. For example, if the daughter was present during the interview and supportive of the need for medical treatment, this would be important to document. Research may be postponed as the emergency need assessment will take priority. In addition, there are times when for adult protective services, an expedited case decision is warranted. In emergency situations and in compressed evaluations, it remains critical to document an assessment of the 6 domains utilizing all context clues from the Observe, Ask, Research model. Documentation should never indicate CMAP was not assessed even in an emergency situation, as even the identification of the emergency situation falls into CMAP assessment. Earlier in this presentation, we discussed that though vulnerable adults often struggle with isolation, this does not necessarily equate to an immediate willingness to share sensitive information about their lives with social work staff. It is critical for social workers to remember how intrusive the evaluation process can feel to clients. Social workers will need to use rapport building skills and sometimes patience to build relationships with clients to gather necessary information. At an initial meeting, the social worker must gather enough information to ensure that there are no immediate safety issues that would warrant emergency intervention or the need to make a case finding in the case of adult protective services as the result of a disabled, maltreated adult who needs protection. If the client is not willing to talk to the social worker may need to focus more intentionally on readily available observations. For example, if the client will not let you into the home, what do you observe about the outside of the home? Is the outside of the home clean and well kept? Are there smells coming from the home? Are there other people at the home willing or able to speak to the social worker? What judgments could be made about finances? Is there observed running water, electricity, television, food, telephone? What observations can be made about health? While outward appearance should never be relied on as a sole indicator of physical health, context clues should be noted. Is the client breathing, walking, communicating clearly and without struggles? Most seasoned social workers can identify with having been a part of a conversation where a client hurled profanities or obscenities their way. As a social worker who is trained to de-escalate conflict and identify strengths and needs, even in difficult situations, it is important to use the communication available, even when not friendly, as part of your evaluation. For example, Instead of focusing on the profanity, focus on the communication. Was the information being communicated understandable? If a client is closed off to engagement in the CMAP process, it may be important for the social worker to carefully weigh questions to prioritize those that are most important early on and come back and ask additional questions at a later date as rapport builds. The most important thing to note is that social workers should never not assess CMAP due to closed off clients, but rather should focus in on those areas that are most timely and utilize collaterals and relevant records to piece together the assessment process. The COVID-19 pandemic placed the idea of virtual contacts at the forefront. However, virtual contacts is not a new concept. Social workers have always used telephone contacts as a means of connecting with clients and collateral contacts. While face-to-face client contact will always provide a more robust ability to assess CMAP, telephone contacts or virtual contacts, such as via Skype or FaceTime, require added sensitivity. Remember that if a client or collateral contact cannot see your body language or feels a disconnect due to the technology, this may be an added barrier to CMAP. One method of combating this would be to ensure that CMAP assessments never read like a script, but always take the shape of a get-to-know-you conversation. For example, conversations should never begin with a problem focus or global questioning, such as questioning, "Do you have any problems?" or a leading question, such as, "Everything is fine with you, right?" Answers to questions will often match the depth and breadth of the questions asked. Closed-ended questions that solicit yes or no responses should only be used as part of a diverse questioning experience that also includes open-ended and choice questions. If yes or no questions are utilized, it is important to follow up on the responses by asking the client to tell you more about the subject. Collateral contact should be robust and should also focus on assessing CMAP, as opposed to pointed questions that focus only on allegations or concerns. Remember that collateral contacts are a purposeful part of the evaluation and to the assessment of CMAP.
I hope you have found this information helpful. If you have further questions about the implementation of this guidance, please contact our listserv at das.adultservices@dhhs.nc.gov.